Let's just jump into it. Can you get into the different symptoms associated with these three, COVID, the flu, RSV? How can we tell the difference?
Sure. Hi, Tinkley. Thank you so much for having me. So I will say this, and I think a lot of physicians and clinicians will say the same. There's a lot of overlap in terms of the symptoms between these three viruses. Most of them, you'll have runny nose, you'll have cough, and you may have fever. With COVID, you will have a loss of taste and smell. With the flu, you may have more generalized symptoms. So you may feel body aches, malaise, fatigue, also may have a little bit of diarrhea as well. And then RSV, often when it impacts infants or small children, they can have difficulty breathing. So it can sound like they're wheezing or having asthma type symptoms. So, but again, there's a lot of overlap. And if you are concerned at all, definitely talk to your healthcare professional.
And how do they differ in terms of vaccine availability as well?
Right. So that is very, very important. So unfortunately, we do not have a vaccine yet for RSV. There are some clinical trials going on and they're showing great promise, but there are two pretty effective vaccines against COVID and the flu. So I would recommend people, just because of what we're seeing, these really, really high rates, especially of flu, the highest in a very long time. We're seeing COVID cases rise, that if people are not fully vaccinated and haven't gotten their boosters for COVID, go out and get those, because those are still showing great efficacy against severe disease, hospitalization, and death. And also the flu shot is working quite well this season as well.